Hey guys, my name's Lauren Dark. I am a first semester nursing student at Auburn University School of Nursing, and today I'd like to take a little bit of your time and talk to you about the Vietnam War, the Vietnam veterans, what they are exposed to. I'm mostly going to focus on Agent Orange and what these exposures have led to later in their lives, so like prostate cancer. And then we'll talk a little bit about the treatment options available for those individuals who are questioning their prostate health. But first of all, I want to go ahead and give you a short background about Agent Orange. If you don't know, Agent Orange was a key component to the chemical warfare used during the Vietnam War. Agent Orange is a chemical defoliant or herbicide, and it was sprayed from the U.S. military planes over the Vietnamese jungles. And the reason they took this action was to reduce the amount of foliage or reduce the ability for the Vietnamese military to remain camouflaged in these jungles. But later down the road, years later, they realized that the manufacturing process of Agent Orange had been compromised and that Agent Orange was contaminated with a really powerful toxic chemical. And the name of this chemical is 2,3,7,8 tetrachlorodibenzo-P-dioxin, or TCDD. And like I said, TCDD is a really potent carcinogen. It causes mutations in the DNA and triggers rapid mutated cellular growth in divisions. So, individuals could have came into contact this through direct skin contact. They could have inhaled these chemicals through their nose, and it could have led into their respiratory tract, or they could have ate crops that were exposed and contaminated with Agent Orange and this TCDD toxin. TCDD, the chemical has a really long half-life, and it can be detected decades later after exposure in human adipose tissue or in fat cells. And high levels of the dioxin are related or significant predictors of prostate cancer. And it's been estimated that 3 million military personnel were exposed to Agent Orange during the Vietnam War. And of those 3 million, 1.4 million men will acquire prostate cancer by the age of 60. And so we got to think, prostate cancer, it causes inflammation of your prostate or the male's prostate. It can cause pain and difficulty while urinating, and also erectile dysfunction. So it's not just, you have to think, it's not just physical, it's also mental and emotional debilitating to these veterans or anybody in general who has prostate cancer. But luckily there are treatment options available. What one would do is go to their primary health provider or their oncologist if they do know that they have cancer, and they'll work out a treatment plan. These vary from active surveillance to radiation and chemotherapy to even surgery. And the even better thing is that there are screening options available. And these are essential for finding cancers in their early stages. You always want to find any type of disease or disorder in its early stages so you can treat it faster and sooner. Better get it all over with. The screening options, there's multiple things that one can do. They can go get physical examinations, they can get digital rectal examinations, or transrectal ultrasounds. And this all accesses the prostates by means of the rectal wall. And some people may say that that seems really invasive, but there's also less invasive measures out there, like the prostate-specific antigen test, or PSA test. And what one would do to acquire this test is go to their physician, they go to the lab, get blood drawn, and then the laboratory would grade how much PSA or prostate-specific antigen is actually in the patient's blood, and the levels would determine the health of that patient's prostate. So I hope that this little video has been beneficial and that you learned something new every day. And just remember that screening options are available. Your health is really important. And I hope that y'all do well in all your educational endeavors. War Eagle!